Good morning. This is Dr. Jim Waller from Tri-State Colorectal Surgery. I wanted to take this opportunity this morning to talk with our patients and the general public out there about the differences regarding colonoscopy and Cologuard. I have been faced with the task recently of having to get on the phone and talk with some patients and/or family members and primary care physicians about the fact that uh, patients have been very upset when they received a bill for their screening colonoscopy. And I say screening, use the word screening here somewhat loosely, but patients are concerned because they've received a bill for their screening colonoscopy, which they assume would be covered by their primary insurance. The problem being in these patients that they first had a Cologuard test done, which was positive, and then were subsequently referred to us to do a colonoscopy as a result of the positive Cologuard. And in situations like this, the colonoscopy is not considered screening. In this case, it's considered a diagnostic colonoscopy because the patient had an abnormal test. So I want to just take the time to talk a little bit about each test and our rationale for the test, their efficacy, and pros and cons of each of these tests. Now, colon cancer is a very common cancer in the United States and throughout the world, significant cause of cancer deaths. We have found over the past 3 or 4 decades, however, that by doing screening and removing precancerous polyps before they become cancerous, that we can significantly reduce the risk of developing colon cancer. We can't completely remove the risk, but we feel like we can prevent most cases of colon cancer by doing screening examinations, finding polyps, and removing them. This is what made colonoscopy the gold standard for doing colon cancer screening. We recommend colonoscopies on anyone who has reached 45 years of age or older, and that these be done every 10 years in patients who have no family history of colon cancer, colon polyps, or in patients who have never had a cancer or had a polyp themselves. In those situations, we recommend that the examinations be done more frequently. And in fact, in the case of patients with a family history of colon cancer or colon polyp, we recommend that the patient have their first examination at approximately 10 years, at 10 years younger than the person in their family who had the polyp or the cancer. And in those cases, we recommend that the patient then have repeat colonoscopies approximately every 5 years, or sooner should they have multiple polyps or have a large polyp. So that's been the standard now for several decades, and we've seen the incidence of colon cancer decrease as a result of our screening program. To talk a little bit about pros and cons of colonoscopy versus Cologuard, one of the big complaints that people have with regard to the colonoscopy nowadays, anyway, is the fact that you got to take a prep. And I've been through 5 preps. I've got a family and personal history of polyps or cancer in some of my relatives, and so I began my screening at age 40. And I know about the preps. I can tell you that the preps have improved significantly in the 2 or 3 decades, since I've been doing my exams, and that remains, however, the biggest complaint people have, because the procedure itself is almost always painless. The physician or healthcare provider who is doing the colonoscopy, first of all, they're well trained before they are certified to do colonoscopies, but virtually all providers now are doing some type of anesthesia or sedation. So colonoscopy really has become a painless examination. And if we do a biopsy or if we take a polyp out during the procedure, that's painless, because the inside lining of the colon, as with most of the GI tract, there's no pain sensitivity, not to the type of pain one would think of with if we did a biopsy from the skin. Most people just have no discomfort or sensation whatsoever if we take out a polyp or do a biopsy. The procedure takes about 30 minutes. It can take longer if a person has multiple polyps, or if the physician just has to take a little more time getting through the colon. But when the patient wakes up in recovery, except for some bloating, a little bit of gas, you're ready to go home in a half an hour or so, and no discomfort. And the big advantage being that if a polyp is discovered, it can be removed at the same time as the procedure in most cases. If we find something that we suspect may represent a cancer, we can do biopsies. We can tattoo the bowel. We can put some dye under the lining of the colon near the lesion in the event that the patient is going to require surgery to either remove a very large polyp or to do a cancer operation. And we tattoo the areas so that we can do these minimally invasive, because I would say certainly most colorectal surgeons in the country nowadays, as well as general surgeons, are doing laparoscopic or robotic colon resections in those patients who need removal of a large polyp or cancer. So the downside of colonoscopy would be that you've got to undergo a prep. However, it's just I can assure you, it's just not, they're not as difficult as they were in the past. And I've done, virtually having done 5 of these, I've intentionally tried the different preps so that I could inform patients of what each one was like. And it is the worst part, but it's certainly well worth it, given the comfort of the exam and the efficacy of the exam. People ask quite often about complications, and there can be complications to any procedure. Colonoscopy, however, is very safe. The 2 complications that can occur would be a perforation, and that is extremely rare. I did well over 60,000 of these when I was in active practice, and had less than 5 patients ever have a perforation. And even in those patients, at least half of them do not require surgery. The little hole will close on its own. But this is very rare. It's a very rare occurrence. And I think of myself when I talk to patients about their concern about having a colonoscopy, because it is a real concern. I've always said that it was never even a question in my mind, because I know that the risk of the average adult in the United States developing a cancer, if they put their head in the sand and don't do a screening exams, is about 1 in 19 or 1 in 20, versus the risk of 1 in several thousand to have a significant complication during the examination. So those are the 2 downsides of a colonoscopy: getting a perforation or bleeding. And I might say also that I never had a patient who developed bleeding that required redoing the colonoscopy or taking them to the operating room to stop the bleeding. But those are things that could be done to stop bleeding. I never had that happen in my practice. It's not that it can't happen, but it's exceedingly rare as well. So that's a colonoscopy. That's the gold standard. And again, it's the gold standard because we can directly visualize the colon. We can remove polyps. We can do biopsies when needed. We can tattoo the colon in preparation for an eventual surgery if this is a patient who will require surgery. Now we contrast that with Cologuard, and Cologuard is very interesting. It's very interesting because in today's day and age, we have a lot of medical advertising going on TV. And I first saw a Cologuard commercial back during the Stanley Cup playoffs in 2015. And I remember thinking then that, well, this may create a bit of a problem. The Cologuard certainly has its pluses, and it also has its minuses. But I thought this is going to present a problem because, the advertising is, do it in the comfort of your home. They give you this it's a hat-shaped receptacle that you poop in. So you take a crap in the hat, so to speak, and then you send that off to be tested. And what they are testing is they're doing a genetic analysis on the stool to see if there's any evidence of mutation that can be found in cells that are shed in the stool that might indicate that a patient has a polyp or a cancer. Now, Cologuard is very good at detecting cancers. Now, remember that. It's very good at detecting cancers. It detects, upwards of 90% of cancers. It's not so great at picking up polyps. And you may remember that I mentioned earlier, polyps are important because by doing colon examinations, finding polyps and removing them, we don't prevent all cancers, but we can prevent most, if not all cancers. So that's an important concept. And Cologuard is not so great at picking up polyps. Probably misses 40–50% of polyps that are a centimeter or less in size. And the 1 centimeter mark's important to those of us, those gastroenterologists and colorectal surgeons and primary care physicians who do colonoscopies, because when polyps get in that 1 to 2 centimeter range or larger, we know there's a higher risk that they have already developed some cancerous cells. So Cologuard's not so great at picking up polyps. And if you just go back to what we can do with a colonoscopy, and that is remove polyps to prevent cancer, that's a serious issue with doing a Cologuard test. Here's the other thing, though. Cologuard is great at picking up cancers, but we don't want to pick up cancers. We want to find polyps and remove polyps before they become cancerous, potentially before they become so large that even though they may still be benign, you still need to have a colon resection. So therein lie the two issues with Cologuard. Good at telling whether you have a cancer or not, but finding a cancer after it has already developed is kind of like closing the barn door after the horse has escaped. So that is a serious shortcoming of the Cologuard test. Sure, it's easier. You can do it in the comfort of your home, but we're not detecting polyps and removing them to prevent cancer. We're looking more to say that, okay, your test is negative, so it's very likely you don't have cancer, without knowing for sure what your polyp status might be. So that's a big problem. The other thing that prompted me to do this discussion, as I said before, is the fact that I've had to work with some patients and some primary care providers in the last several weeks. In fact, I've had 4 patients where this has occurred, who were referred to us because they had a positive Cologuard. They were referred to us for a colonoscopy because they had a positive Cologuard. That's the next step. Now, the problem arises when we see those patients in that we cannot code that as a screening colonoscopy. It's not a screening colonoscopy. Their screening exam was their Cologuard test. The Cologuard test was paid for. Their colonoscopy is now a diagnostic colonoscopy because they had an abnormal test. And a diagnostic colonoscopy is not always paid for by the patient's insurer. And as a result, in the 4 patients that I have tried to help with this, they've incurred bills of anywhere between $3,000 and $12,000. That's a big hit. I have always been very sensitive to the financial burden that we place on patients in our healthcare system, because the average individual's they're just not going to have that. And to me, that's a problem. And therefore, I think it's important that people understand the difference between screening, which is, as we know, is covered, and doing diagnostic or therapeutic testing or procedures, which may not be covered by your insurance, depending upon deductibles and just the terms of an individual's insurance policy. So that's a significant problem. And having had this conversation several times in recent weeks, I just think it's important that we make people aware of the difference. And in my case, and I would say in the case of many healthcare providers, we want to encourage patients to go with the gold standard, go with colonoscopy as your screening procedure for all the reasons we've talked about, because in the end, it may really be much better for you financially, as well as with regard to your overall health and longevity. So I hope this has been helpful. If you have any questions, please feel free to submit questions. If I can't get to them, within the next few hours or so, I can assure you I will be happy to answer questions in due time. So thank you. Stay tuned for more broadcasts. And should you have any other questions or concerns, feel free to reach us via our website, colondocs.net, or via the office, Tri-State Colorectal Surgeons, 812-301-8110. Again, thank you.